You're listening to Battling Opioids, the podcast. Battling Opioids, the podcast, now on Apple Podcasts, Stitcher, Google Podcast, TuneIn, Amazon, YouTube, and now radio.com.
Next topic. What if there were an opiate that didn't stop your breathing, didn't give you euphoria, didn't make you constipated, didn't suppress your immune system, didn't suppress your testosterone? It's a rhetorical question. There isn't such an opiate called buprenorphine, which is what's in Suboxone, which is what's used for opiate addicts as a medication-assisted treatment. You take methadone, Suboxone, or the naltrexone blocker in a shot, works real well once a month, Vivitrol. The problem is, so I'm on a bandwagon. I'm very angry about this. And I say stupid doctors very respectfully and very in parentheses. But this opiate is available. It's been available since 1980. It's extraordinarily safe. As a single agent, in other words, if you're not taking it with Xanax or drinking with it, you could inject it IV, hundreds of milligrams, and you wouldn't die. Okay, 200 milligrams of oxycodone will kill 50% of the people you give it to, the LD50. This stuff is extraordinarily safe. But because it's used in Suboxone for addicts to suppress craving, it is seen by most doctors will say, oh, is it an opiate? Yeah, just another opiate. So it's very interesting. So there is so when I get a patient, now a lot of people do have chronic pain. They have they're on opiates. They're on their 6 Norco a day, or they're on more than the 90 morphine equivalents a day. Doctors now are so scared they're just cutting them off. They're detoxing them over a week and saying good luck with the Motrin and Tylenol. And a lot of people are suicidal. They do need there are people that do need opiates, and they need it at higher than the cutoff level that the CDC's recommended. It's great. It's a fantastic pain medication. And those of you out there, there's a guy named Dr. Corey Waller, Waller, and he's got a great video. If you have a loved one that was on opiates and was inappropriately, these were discontinued, take a look at that and look at this medication for pain. Even for addiction, there are a lot of people. There's a huge schism in the recovery community, and Drew and I have some disagreements on that, saying, nope, it's just another opiate. Giving an opiate to an addict, eventually, if they take it to suppress their craving, they're just going to relapse again, which again, there's some constraints. You need to help somebody with structure, but using methadone or Suboxone really, really does work. If you take somebody off opiates and you put them out to a 12-step program, that's all they do. The recovery, the relapse 90% within a year, essentially. If you put them on Suboxone, methadone, or Vivitrol, it's 60 to 70%. So they estimate in LA 50% of the homeless have an opiate addiction.
Recovery starts with a call. Call 1-800-662-HELP or visit battlingopioids.org.
It doesn't take long to become addicted to opioids. 13 Pennsylvanians die from them every day. Geisinger is committed to ending opioid addiction with both prevention and treatment. In the last 3 years, we've reduced the amount of opioids we prescribe by 50%, and we've opened 4 medication-assisted treatment centers across the state to help patients recover from addiction. Learn more at geisinger.org/hadenough.